All right, Dr. K, thank you. It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, a dermatology clinic in Carmel is the first in central Indiana to use a new high-tech treatment for non-melanoma skin cancer. The conventional treatment for these common cancers is surgery to remove the cancerous tissue. But Business of Health reporter Kylie Valletta tells us about a new option for Hoosier patients. Kylie.
That's right, Gary. The new treatment is non-invasive. No scalpels, no cutting, and no stitches. The technology is designed to treat basal cell carcinoma and squamous cell carcinoma. These are the two most common forms of skin cancer, and they've reached an alarming level in the U.S., increasing 77% in the last 2 decades. Dr. Sally Booth with Booth Dermatology is the first doctor in central Indiana to offer the new treatment, and she joins me now to tell us more about it. Thank you for being here.
Thank you, Kaylee. It's a delight.
So before we get into this new treatment, give us just a quick snapshot of what the traditional treatment is for these non-carcinoma skin cancers.
Well, the treatment for non-melanoma skin cancers, basal cell and squamous cell, traditionally is some sort of surgery, either scraping the cancer and letting it heal or excising it, along with Mohs micrographic surgery, and that involves stitching, cutting, pain.
Right. So let's talk about this new treatment. You're the first doctor in central Indiana to offer it, superficial radiation therapy. What is it and how does it work?
Well, radiation therapy, superficial radiation therapy, is basically a low-dose X-ray therapy that was specifically devised just for superficial skin cancers. And the X-ray photons are taken up more readily by the cancerous skin cells, and so just gradually melted away with a series of brief treatments, 17 to 20 times, and that no cutting, no downtime, no surgery.
So what are the key benefits? You mentioned, no downtime, but no scarring. What are some of the other benefits?
The benefits are that a patient who is on blood thinners or with tendency to poor wound healing, such as diabetics or immunosuppression, will not have to risk those complications. The patient doesn't have to have, as I said, the pain and downtime of going through surgery and scarring, that kind of thing. And the cure rates are similar, equivalent to Mohs surgery, 95–98% cure rate for these types of cancer.
And you mentioned in Mohs surgery, while that procedure is going on, you're checking during the procedure to make sure that you've gotten all the margins, that all the cancer tissue is gone. So how do you do that with superficial radiation therapy? How do you know that you got all of the cancerous tissue?
Well, the great thing about this new device is that there's an imaging arm that ultrasonically images the cancer each time we treat, and we check to be sure that it's responding, and we can see the cancer cells are different than the surrounding normal non-cancerous skin cells because they lack oxygen, so they do not show up on ultrasound the way normal skin cancer cells do. So we see the tumor melting away and then gradually filling in with new healthy tissue.
That's fascinating. So you mentioned half of dermatologists in the southern part of the U.S. are already using this. So, why are you one of only a few in Indiana, and do you expect more dermatologists to adopt it?
I definitely do, because skin cancer is growing, and gradually the word is getting out there about the benefits of this treatment. It was developed in the South, and there's a lot of skin cancer in the South, so I believe that it's gradually spread from there, and more practices have adopted there.
And you mentioned this is a great treatment also for people with keloids.
Yes, it's a fabulous treatment for keloids, or thickened scars that just will not go away, that cause patients pain, disfigurement, and that have been treated previously by cutting them out or injecting them, and they just keep wanting to come back. And we've got a greater than 95% cure rate by cutting them and doing 3 brief radiation treatments.
This is very good news for a lot of patients.
Yeah.
Dr. Sally Booth, thank you so much for being here today.
Thank you so much for having me.
Gary, back to you.